When it comes to serious viral infections like coronavirus, the recovery process is not a quick one.
If you have a bad flu or bad pneumonia, everyone will accept the fact that it just takes a while. I mean, you were dead sick for 4 or 5 weeks. So go figure, it takes a while to get back to normal.
Dr. Martin Kolb, the director of the Institute of Respiratory Health at McMaster, says while he's seen very few COVID-19 patients with long-term issues, there are cases elsewhere.
But people clearly are still somewhat breathless, and if you measure their breathing function, even 4 months afterwards, in some people, it's still abnormal, which is kind of unusual, definitely puts up a little bit the alert flags.
Kolb says it's far too early to confirm what lasting effects are possible. However, a list is forming. Last month's issue of Nature magazine highlighted that some patients experience lung damage up to 3 months after discharge. This scan is of a 50-year-old man. The red represents injuries to his lungs. The report also points to heart issues due to inflammation caused by an overreactive immune system. Additionally, chronic fatigue is also documented. While studies are just starting in the United Kingdom and the U.S., groups right here of patients called long haulers are sharing their continued struggles.
There's deaths, right? And then there's recoveries. But what they're discovering now is that people really aren't recovering.
Susie Golding says she's been dealing with a wide variety of symptoms for the past 7 months.
Came on this kind of post-viral wall of fatigue where just, I've never been so tired in my life. All the cognitive issues started, like the brain fog started happening. And that's sort of where I am today. I've been left with a lot of neurological issues.
Golding is administrator of a long haulers Facebook group, which has over 6,000 members, all sharing their experiences.
There are over 100 symptoms. We've done a poll about symptoms and symptom onset. Now, there are some very similar symptoms that we all share.
I just want to reiterate, experts are saying it's still too early to confirm if COVID-19 has any lasting effects and what they are exactly. In the meantime, anyone recovering from COVID-19 should continue to self-monitor, and if they're experiencing something like difficulty breathing weeks later, they shouldn't wait and contact a specialist through their doctor.